Welcome to Study Nurse IQ's NCLEX and ATI-style practice quiz. Today we'll cover 30 questions on pharmacology, drug interactions, and patient safety. Let's begin. Question 1. A client is prescribed a medication that is known to be a substrate for CYP3A4. The nurse understands that if this client consumes grapefruit juice, the drug's effect may be altered. What is the most likely outcome of this interaction? The correct answer is D. Grapefruit juice contains components that inhibit CYP3A4, which is a major enzyme responsible for drug metabolism. An inhibitor of a CYP450 enzyme decreases the metabolism of its substrates, which can lead to an increased drug effect and a higher risk of adverse reactions. Question 2. Which of the following factors can influence drug metabolism and response due to genetic polymorphisms? Select all that apply. The correct answers are A, B, D, E. Genetic polymorphisms, such as those related to the cytochrome P450 system, contribute to variations in pharmacokinetics and pharmacodynamics. Individual, racial, and gender differences in the CYP450 system can explain different reactions to the same drug. Environmental factors also alter gene expression of CYP450 families. Additionally, the extremes of age are risk factors for adverse drug reactions. Question 3. A new drug is being tested for safety and effectiveness. During Phase 2 of the new drug approval process, the drug is typically tested on approximately how many volunteers to establish its effectiveness? The correct answer is 100 to 300 volunteers. Phase 2 of the drug testing process involves 100 to 300 volunteers to establish the drug's effectiveness and to look for side effects. Question 4. Place the phases of the new drug approval process in the correct order. The correct order is 1. Preclinical research, 2. Phase 1, safety, 3. Phase 2, effectiveness, side effects, 4. Phase 3, effectiveness, adverse reactions, and 5. New drug application, which includes post-marketing research, Phase 4. Question 5. A nurse is reviewing a prescription. The nurse understands that all of the following information must be included. Click on the 2 areas of the prescription that provide information about the prescriber. The correct areas are the sections for practitioner information, name, contact info, DEA number, and the date on the prescription pad. A complete prescription must include the practitioner's information and the date of issuance. Question 6. A 65-year-old male with a history of hypertension and hyperlipidemia is being discharged from the hospital. The healthcare provider has prescribed a new medication for his blood pressure. The patient has been compliant with his previous medication regimen. Which of the following is a critical first step in the process of rational drug prescribing for this patient? The correct answer is B. Define the patient's problem. According to the process of rational drug prescribing, the first step is to define the patient's problem. This ensures the correct diagnosis is made before a therapeutic objective is specified and a treatment is chosen. Question 7. According to the provided document, who is responsible for determining what is considered a prescription drug versus an over-the-counter OTC drug? The correct answer is C. The federal government. The federal government decides what is a prescription drug versus an over-the-counter drug. States decide who can prescribe what and the scope of a practitioner's prescribing authority. Question 8. Which of the following are characteristics of an over-the-counter OTC drug? Select all that apply. The correct answers are A, B, C, E. An OTC drug must be safe, have a low potential for abuse or misuse, and can be labeled. The patient must also be able to self-diagnose and manage the condition. OTC drugs are approved and labeled by the US FDA. Question 9. For C3 through CV prescription drugs, the quantity must be written out numerically and as a word. For example, if a prescription for Vicodin, a Siri drug, is for 20 tablets, the prescription should read, dispense number 20. The correct answer is 20. For CV prescription drugs, the quantity must be written out numerically and as a word to prevent abuse or reordering of narcotics. Question 10. A prescriber is writing a prescription for a controlled substance. Place the following steps for secure and complete controlled substance prescribing in the correct order. The correct order is 1. Store the prescription pad in a locked area. 2. Ensure tamper-proof paper is used. 3. Include the DEA number on the prescription. 4. Spell out the quantity. These steps ensure security and prevent prescription fraud. Question 11. A patient taking warfarin, an anticoagulant, is being educated on potential drug-food interactions. The nurse should advise the patient to avoid which of the following? The correct answer is B. Warfarin is an anticoagulant, and vitamin K-containing foods can increase clotting, which would counteract the effect of the drug. While other options may affect different medications, they don't significantly impact warfarin's effectiveness. Question 12. Food can influence drug therapy in which of the following ways? Select all that apply. The correct answers are A, B, C, D. Food can affect drug absorption by changing the absorptive surface area and bioavailability. It can change gastric pH, bind with medications, affect metabolism rate, and change urinary pH, which affects drug excretion. Question 13. A patient taking an anti-seizure medication, phenytoin, is at risk for drug-induced nutrient depletion. The nurse should monitor this patient for a reduced level of what nutrient? The correct answer is folic acid. Phenytoin, an anti-seizure medication, is known to reduce the level of folic acid. Question 14. A nurse is providing education on dietary considerations for a patient taking a monoamine oxidase inhibitor, MAOI. The nurse should instruct the patient to avoid which foods? The correct foods to avoid are cheese, wine, and pickles. Patients on MAOIs should avoid tyramine-containing foods, which are typically aged, fermented, or pickled, such as aged cheeses, wines, and pickles. Question 15. A 45-year-old male with a history of depression is being started on an MAOI. The patient is also an avid consumer of fine wines and aged cheeses. Which of the following is the most significant risk associated with this interaction? The correct answer is C. MAOIs inhibit the enzyme that breaks down tyramine. Consuming tyramine-containing foods like aged wines and cheeses can lead to a dangerous buildup of tyramine in the body, causing hypertensive symptoms. Question 16. A patient taking a new medication reports a delayed skin rash that appeared 24 to 48 hours after the first dose. The nurse understands this is a type of allergic reaction known as. The correct answer is C. Type 4 allergic reactions are cell-mediated, delayed reactions that occur 24 to 48 hours after contact and are characterized by the presence of T cells. Anaphylaxis is a type 1 immediate reaction. Serum sickness is a type 3 delayed reaction occurring 1 to 3 weeks post-exposure. A cytotoxic reaction is a type 2 autoimmune response. Question 17. Which of the following patient factors can increase the risk of developing an adverse drug reaction ADR? Select all that apply. The correct answers are A, B, C, D, E. The provided document lists all of these as factors that can predict or increase the risk of ADRs. Age extremes, body mass, lean and obese patients, gender, pathologic state, renal or hepatic dysfunction, and genetic factors are all listed as risk factors. Question 18. A nurse is providing education to a patient about their new prescription. The nurse should ensure the patient education is delivered at what grade level to promote understanding? The correct answer is 5th or 6th grade level. Patient education should be delivered at a 5th or 6th grade level to ensure the patient can understand the information. Question 19. A nurse is reviewing a patient's medication profile and notes several risk factors for adverse drug reactions. Place the following activities that increase the risk of drug reactions in order from most to least likely to be associated with a patient's actions. The correct order is 1. Use of over-the-counter drugs, 2. Use of multiple providers, 3. Use of alcohol, 4. Poor compliance, overuse, or underuse. These activities are listed in order of likelihood to be associated with patient actions. Question 20. Click on the 2 sections that a patient can use to help self-diagnose and manage a condition. The correct sections to click are indications and directions. The ability to self-diagnose and manage a condition is a key characteristic of an OTC drug. The indications section helps the patient determine what the drug is used for, while the directions section provides guidance on how to use it safely and effectively. Question 21. A patient with a history of epilepsy and bipolar disorder is being considered for treatment with carbamazepine Tegretol. The nurse understands that this patient should undergo genetic testing for which allele before starting the medication, especially if they have Asian ancestry. The correct answer is B. The FDA has recommended genetic testing for the HLA-B1502 allele in patients of Asian ancestry before initiating carbamazepine therapy due to the high risk of developing Stevens-Johnson syndrome (SJS) or toxic epidermal necrolysis. Question 22. Which of the following are definitions related to pharmacogenomics? Select all that apply. The correct answers are A, D, E. The document defines pharmacogenomics as the influence of genetic variation on drug response in patients by correlating gene expression with a drug's efficacy or toxicity. Genetic polymorphism is defined as genetic material that determines individual variations in enzyme activity. Question 23. A patient who is homozygous for a lack of a working enzyme that metabolizes a certain drug is known as what type of metabolizer? The correct answer is poor metabolizer. A poor metabolizer is defined as a patient who is homozygous for a lack of a working enzyme. Question 24. Place the following phenotypes in order from the slowest drug metabolism to the fastest. The correct order from slowest to fastest is 1. Poor metabolizer, 2. Intermediate metabolizer, 3. Extensive metabolizer, 4. Ultra-rapid metabolizer. A poor metabolizer has a lack of working enzyme, making their metabolism the slowest. An intermediate metabolizer is heterozygous for one working allele. An extensive metabolizer is homozygous with two normally functioning alleles. An ultra-rapid metabolizer is heterozygous with more than one functioning copy of a certain enzyme. Question 25. A nurse is providing education on pharmacogenomics. The nurse explains that the CEP450 system is a key example of how genetic material determines individual variations in enzyme activity. Click on the part of the provided image that represents the enzyme responsible for drug metabolism. The correct area to click is the endoplasmic reticulum, where the CYP450 enzymes are primarily located. The document states that CYP enzymes are involved in about 75% of drug metabolism and bioactivation in the liver. The CYP450 system is located primarily in the endoplasmic reticulum of liver cells. Question 26. A parent asks a nurse for a decongestant for their 3-year-old child. Based on the provided document, what is the most appropriate response from the nurse? The correct answer is B. The document states that decongestant medications for infants, young children have been removed from the market or relabeled not to be used for children under 4 years of age. Question 27. Which of the following are potential hazards of using over-the-counter OTC medications? Select all that apply. The correct answers are A, B, D, E. The OTC hazards section lists inaccurate dosing, toxic levels due to overdose, acetaminophen toxicity, and overuse as potential hazards. Reduced effectiveness is not listed as a hazard, but a potential risk of using some herbs and supplements. Question 28. A nurse is counseling a patient about the potential for OTC abuse. The nurse explains that pseudoephedrine is a precursor to what drug, which is why federal law restricts the daily and 30-day amounts that can be purchased. The correct answer is methamphetamine. The document notes that pseudoephedrine is a precursor to methamphetamine, which has led to federal laws restricting its purchase. Question 29. A nurse is reviewing a patient's history of OTC abuse. The nurse understands that this active ingredient is often misused for its psychoactive effects. Click on the area of the bottle that contains the active ingredient being abused. The correct area to click is the section on the label that says dextromethorphan. The document explicitly mentions dextromethorphan abuse, stating that it can cause dysphoria at high doses, similar to LSD. 30. A nurse is explaining the process for a new over-the-counter drug to be approved. Place the following steps in the correct order. The correct order is 1. The drug must be safe. 2. The drug must have a low potential for abuse or misuse. 3. The drug must go through the NDA process. 4. The drug is approved and labeled by the FDA. For an OTC drug to be approved, it must first be safe and have a low potential for abuse. It then must go through the NDA process, just like a prescription drug, before it is approved and labeled by the FDA. Great job! You just completed 30 NCLEX and ATI-style questions with Study Nurse IQ. Keep practicing. Repetition is the key to success. Thanks for watching Study Nurse IQ, Nursing Made Simple.